relationship between any oncologic process and sleep is a really fascinating one because when you talk to most people about this topic, there's this reflexive thought of, well, of course, patients who have cancer are sleepy, they're getting chemotherapy. And many times the knee-jerk reaction is really to boil down the relationship to purely thinking about the quality of life after someone's diagnosed. The thing that is interesting when talking about cancer is the relationship between cancer and sleep and circadian science is one that cannot be ignored. In fact, in 2007, the World Health Organization had come out with a statement stating that things like shift work disorder are a likely carcinogen. That's right. You being a shift worker is going to increase your odds of cancer. This now has only been further verified with the most recent publication in January of 2024, looking at the UK Biobank's actigraphy data, which included more than 1 million data points, and examining what is the survival curves or the all-cause mortality for different types of circadian patterns. You're right, you guessed it. I'm going to tell you that the more dysfunctional your circadian rhythm, the higher likelihood is that you are going to die from something, including cancer. Now, with that stated, we have for years perpetuated the idea that duration of sleep was the only thing that mattered. Less than 6 and greater than 9 hours were going to increase your all-cause mortality. You put a side-by-side of duration versus regularity of sleep, and the duration walks away with its tail between its legs. The reason why is because regularity of sleep is demonstrating even more impactful consequence in regards to your likelihood of experiencing and dying from things like cardiovascular disease and cancer. Now, why might that be? Well, there has been ongoing data to demonstrate that circadian science has a tremendous role for every single organ system in our body. When looking at the 2017 Nobel Prize for the 3 men who discovered and characterized the molecular process of clock genes, what we've identified is that there is a DNA signature that tells our body this is how and when it should be working. And so therefore, there is a peak time of function for every single cellular function in our body. You know what else there is? There is a circadian expression for every single disease process we experience. So when we start functioning outside of what our bodies have been designed to do, we're going to experience consequence. The same as if you're driving around and you have something wrong with your tires, you're going to see that your axles aren't going to like it and you may end up with a broken one. So the reality is don't break your axles. Make sure you are maintaining a circadian alignment. You want some real life examples of how we see this in clinical practice? Let's start with breast cancer. For years, we've demonstrated that when you have circadian dysfunction in a woman, you identify that that woman is going to be more likely to have a more invasive, aggressive form of breast cancer that is less responsive to chemotherapy. There now are machine learning models that are looking at this. They're demonstrating that that likely is because of the fact that there is actually irregularities in some of the clock genes that may be driving some of this dysfunction. You want to look at something else? What about the timing and administration of immunotherapies, such as immune checkpoint inhibitors? What has been found just this year, 2024, is that giving an immune checkpoint inhibitor in the morning is associated with better tolerability and outcomes, not by accident, by design. And this is based on retrospective analysis of over a dozen different studies demonstrating that timing matters. You need one more, 5-fluorouracil. If you have a genetic abnormality in DPYD, which is a gene that does play a role in terms of circadian expression, what we have found is that we need to make sure that we are paying attention to not only the timing, but the dosing that we're giving. Why? Because you're going to end up toxic and you're not going to be able to tolerate the treatment. Therefore, clearly demonstrating that sleep and circadian science matters. It's not a nicety in the quality of life. And although we should not be neglecting those, what we are recognizing is by acknowledging sleep and circadian science as a part of the management and the diagnostics in oncology, we may actually be applying life-saving therapies that can actually be utilized by more people and maybe even prevent for even more. As we look forward to what is the potential clinical impact of sleep and circadian science in the oncology practice, there are several things that we need to think about. First and foremost, if you want to come from a patient-directed or patient-centered lens, we do need to acknowledge what is quality of life. We recognize that things like fatigue and sleepiness are very common in someone who is on their cancer journey and receiving treatments. We also see this as someone who is a survivor of cancer, that may be something that is more protracted and present and may greatly impair the quality of life and even contribute to the experience of accumulating burden from other disease processes. So making sure you get a baseline as well as follow-up sleep evaluations, maybe just starting with clinical interviews, sleep diaries, potentially actigraphy, and if needed, a polysomnography. Now, the second piece is better examination of what is the role of different types of sleep disorders in not only the development of cancer, but also the relevance to the treatment of the cancers. We recognize that when you do have a sleep disorder, that those may potentially increase your risk for more aggressive and invasive cancer. So it is only going to be not just a nicety of improving quality of life, but also may have significance in regards to the effectiveness of the therapies you're providing to treat and cure those cancers. Now, finally, the area that I think is going to be most exciting is really understanding the circadian science related to the oncologic therapies that are available in the oncology experience itself. We are recognizing that this is something that may be highlighted by how someone experiences their circadian rhythm. Do they have features of their circadian rhythm disorder? And is that an early enough sign or a feature that may give some credence to who needs to be screened or where do we need to screen them? It is also important for us to be thinking about these things as we move forward when we're analyzing pivotal trials of FDA approved or being studied chemotherapeutic agents or other therapies that may help in the cancer process. Do we see differences in performance based on the timing and administration of medications, or potentially the timing of someone's sleep-wake cycle? This is an area that I think is still very new and exciting, but one that probably is going to prove to be the most impactful as an area for not only prevention, but successful therapeutic intervention.